Yeah, hi, I'm Dr. Anthony Krawitz from Calusa Veterinary Center, and today I would like to help you to better understand dog ultrasounds. So we're going to answer a couple of questions and hopefully that will get the information across to you.
Dr. Krawitz, what type of conditions or concerns typically require an ultrasound for dogs?
Okay, it's a good question. It's a very comprehensive answer. Almost any condition in the world can actually have an ultrasound used for it, but the most common conditions we look for in dogs is when the dog shows symptoms like vomiting, diarrhea, abdominal pain, blood in the urine, excessive urination, it had an accident or trauma, pregnant, you want to see if they're pregnant, have ate a foreign body, and that may be obstructed with a foreign body. Some x-rays will show foreign bodies, but other x-rays won't show certain foreign bodies like clots or underwear or something like that, and you need an ultrasound in order to see that. X-rays pass right through it. Then we have also ultrasounds are done just to look for what's happening in any sick animal. For example, what's a fever? Why there's an unexplained fever? And that can help us find an answer. And also, I would say that many times ultrasounds are done just to show that everything's normal. A clear ultrasound is actually a very good ultrasound, and sometimes you just do that to prove everything's normal. Those are the type of conditions mainly we use.
How does a dog ultrasound differ from other imaging methods like x-rays or radiograph?
Okay. So let's talk about x-rays first. X-rays use low doses of radiation, and they take a snapshot of what's going on at that time in the patient. It just takes a sudden image like this. It's really good for hard structures and dense structures like bones, foreign objects like metal balls or big hard rubber balls that may be stuck there. It's very good to diagnose things that have a lot of air associated with it, like for example the lungs, or if there's an air in the abdomen from an injury or something, you'll see air very well. But it's not very good for soft tissue structures and looking inside organs. It doesn't see inside the organs at all. It just sees the general shape of the organ. Like for example, a liver tumor would be like a bump on the liver, but it won't tell you if there's a tumor inside the liver if the liver is normal inside. And it applies to the spleen as well. So they are very, so that's x-rays for you. The difference is ultrasounds actually are made by sound waves, ultrasonic high frequency sound waves that you push into the animal. The sound waves bounce back, get picked up by a computer and get converted into an image. And what this allows you to do is actually to take a live 3D, not 3D, but a live video of what's happening in the abdomen at that time, or in the chest at that time. You can see the heart beating. If you look at the chest, you can see the intestine, or the intestines moving, fluids moving, everything like that. So it's actually a video, a live video that you can see inside the abdomen. It's like looking in the abdomen without having to do surgery.
What should pet owners expect during a canine ultrasound appointment?
Okay, so it's actually a non-invasive procedure. The main things we have to think about is that the pet is going to be lying on the table, either on their side or on their back, depending who's the ultrasonographer. And if they lie on their back, they've got these special soft cushions that they lie on to keep them comfortable. If they lie on their side, there'll be a nice comfortable towel that they lie on the one side. So sometimes they can get anxious, and other times not. And also we want to make sure they don't have any food in their bellies, because food produces gas, and gas is the enemy of ultrasounds. It shows up as white lines on the ultrasound image, and you won't be able to diagnose anything. So we don't want them to eat. So your preparation at home is you can take away food from midnight the night before, and come in without them eating, but they can drink. Water's fine. Water doesn't interfere, doesn't produce gas, and also we like the bladder to be a little bit full so we can compare the size and consistency of things on the ultrasound. So once you've done that and you've fasted them, we may, depending on the nature of the pet, we may advise you to give some tranquilizer or sedation pill, something like gabapentin, trazodone, beforehand, which chills them, so when they're lying down, it doesn't interfere with their mood, and they're happy about it. And also it takes the edge off and allows us to actually get better images. For example, if there's a painful tummy, you want to give them something that has pain-killing effect and sedation effect, so you don't hurt them when you press on the belly. The whole procedure can take away anywhere from 30 minutes to 60 minutes, depending what we're looking for and the size of the pet and the person doing the ultrasound. And there's images, videos, and still images are collected from the whole abdomen or the chest, depending which ultrasound we're doing. And some specialists can interpret the images directly and will give you an answer there. On the other hand, a lot of us are just ultrasonographers, and we send the images to a specialist who looks at the ultrasound images, and they give us the opinion and the advice based on that. It really is minimally invasive, and the cats and dogs in this case don't seem to mind at all.
Can you explain how ultrasounds are used to monitor pregnancy in dogs, and when the best time is to schedule one?
Yeah, so that's a good question, because we can diagnose pregnancy on x-rays. X-rays can show the skeletons of puppies. They can see the ribs and the spines and the skulls, but that takes you have to wait for about 7 weeks, which is 42 to 45 days from the time they fell pregnant, to be able to pick that up on an x-ray. Dog pregnancy is only 9 weeks, which is 63 days. And so you're picking up pretty late in the pregnancy time if you take an x-ray. In fact, by that stage, you can usually palpate the belly and feel the pregnancy there anyway. So ultrasounds are very useful for 2 reasons. One is that there is no radiation involved whatsoever, so it doesn't potentially harm the puppies, whereas radiation may, although we do use low doses radiation. And secondly, you can pick up the changes that happen much earlier on. For example, we can see the little placental sac forming from around about 3.5 weeks, which is about 24 days into pregnancy. Probably you can get 95% accuracy of pregnancy at that stage. And then, but by 4 weeks, that's 28 days, it's almost 100% accurate to diagnose pregnancy. And by that stage, we also see the little heart beating, and we can actually see that quite clearly on ultrasounds as well. The only time ultrasounds have a problem with pregnancy is that it's not easy to count the number of puppies compared to x-rays. X-rays, you count the number of separate skulls or spines, and you can get the puppies. But in ultrasounds, because of different depths of puppies, sometimes you don't know what belongs to one puppy and what belongs to another. So there may not be 100% accurate count on that. There'll be 1 or 2 up or down.
What's the process for a cardiac ultrasound in dogs, and when is it recommended?
So cardiac ultrasounds are completely different to abdominal ultrasounds, and they have different reasons. A cardiac ultrasound, also known as echocardiogram, is done usually by a well-trained specialist in the field, and that's usually to diagnose what's going on with the heart. And how we know something's going on with the heart, it's usually murmurs that the doctor picks up, a leaking heart valve, or there'll be a severe arrhythmia where the heart doesn't go boom, 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 boom. It'll go boom, 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 something like that, and we'll have to find out what's going on with the heart. Or if the dog comes in for certain types of coughing or fluid in the chest, and we need to diagnose what's going on with the heart. The procedure is very simple, and I actually forgot to say this in the abdominal ultrasound preparation. We will shave the belly in the dogs to allow the ultrasound to see through the abdomen very well. You put some special gel there and maybe a little alcohol spray to make the contact very, very sharp so that you see good images. And you do have to shave pretty much the whole belly in dogs. But with cardiac ultrasounds, they shave a very small amount of hair just by the heart area, and they can see everything there, the right heart and left heart with that. And they'll also see what the thickness of the heart is, what the wall thickness is. Do the valves leak? Do they close properly? Does the heart contract properly, called fractional shortening? Is it just doing this and not really contracting properly, or does it go like that to make sure that it's contracting properly? All these things are done in ultrasound. It takes literally 20 minutes and you're in and out, and then the ultrasound, again, the images are sent to a cardiologist this time, and they will diagnose the condition and provide medication based on that and the other symptoms of the case.
How do you use ultrasound to diagnose issues like spleen tumors, pyometra, or kidney problems in dogs?
Yeah, so that's just a few of the conditions we look at. Spleen tumors are quite common, particularly in larger breed dogs, and how we do it is we put the probe in the abdomen, and we'll look in the region of where we know the spleen is, and we'll look at the spleen. The spleen is usually a smooth and homogeneous structure of a certain thickness, and if there's a tumor, we'll see circles, either dark circles or white circles, light or dark, hyperechoic or hypoechoic, depending what type of tumor it is, and that can be different sizes. Sometimes it can bulge the capsule, sometimes it's in the spleen itself, and you can only see that from an ultrasound, never on an x-ray, because it's too small. And those are very helpful because it helps us to decide what the treatment and prognosis is. As far as pyometra goes, this is an infection in the uterus of unspayed female dogs that happens quite commonly when they get older. It can be a life-threatening condition. And this, usually the uterus, we can see that on ultrasound. It's usually a very small thing, it's two long tubes, usually about a half to 1 centimeter in thickness at most. And when you have pyometra and the uterus becomes filled with pus, that's really what it does. It becomes 2, 3, 4 centimeters thick, and you'll clearly see that on an ultrasound. And based on that, combined with, say, very high white cells on the blood test and a fever or something like that, you'll know it's a pyometra. And the final one was kidney problems. So there's multiple kidney problems that can happen. Sometimes just age associated, other time from stones in the kidneys or stones in the urinary system, other times tumors. Trauma to the kidneys, for example. So again, the probe, we know exactly by training where to look for the right kidney and the left kidney, and we can look at both of those, and kidney is made up of various structures, and we can actually tell if this layer is thicker, this layer is smaller, or there's circles or balls or swellings or fluid. We can then decide what's exactly going on with the kidney and how bad the kidney is affected. Even old dogs who have chronic kidney disease, they'll have a classic sign where the kidneys start shrinking and get smaller, and also they lose their structure, their classic structure as they age. They become more fibrous, and we can actually determine how bad the kidneys look on an ultrasound in old dogs to give us hyperprognosis. Other things there were mentioned as well on this last question, which was
bladder issues or liver disease.
Okay, so bladder issues. The common bladder issues we look for are dogs who come in either urinating frequently or having blood in their urine, and sometimes not even able to urinate. They're straining and nothing's coming out. So for the bladder, the bladder is the first place we actually start with the ultrasound. We can see the wall thickness. We can see if there's a sludgy material in the bladder. We can see if there's any tumors, obvious tumors, or stones, bladder stones. They shine up as very bright white areas on the ultrasound that have a shadow attached to it, called an acoustic shadow, not a light shadow. And you see this classic sort of line coming down, indicating that the sound waves cannot pass through a stone, and you know it's a stone. It can also tell you if the bladder wall is thickened in certain areas of the bladder. If it's thickened, for example, on the rounded portion of the bladder, that's more like an infection. But if it's thickened on the narrowing portion of the bladder, that's more likely a tumor. And the final one was liver disease. It's a very good one to look at, liver disease. Again, tumors of the liver you can see the same way as I described for the spleen. But the liver also contains the gallbladder, and the gallbladder produces bile, and sometimes you get gallbladder stones or sludge in the gallbladder or obstruction of the bile ducts and things like that. You can see if the liver is very swollen, very white, if it's inflamed, if it's shrunken or got nothing to it, like with liver cirrhosis in liver failure cases. And the one thing I didn't also mention as far as ultrasounds, how useful they are, is to find fluids. It's very, very good at finding fluid. X-rays, if you have fluid, makes a white X-ray. Ultrasounds just because of the sound waves, makes fluid look black. And it doesn't make it destroy the image, it just makes it very sharply demarcated. So if, for example, a tumor of the spleen ruptures and there's bleeding in the tummy or the abdomen, we will put the probe on the abdomen and see right away there's fluid sitting in that abdomen, most likely blood in this particular case. Other reasons for fluid in the abdomen are many. Low protein can cause fluid in the abdomen, but also just an abscess or some cyst or something will show up very clearly in ultrasounds. So these are also very, very good advantages of an ultrasound over x-rays. And the final point there is when you use an ultrasound, you can also do what's called a ultrasound guided fine needle aspirate or a true cut biopsy of the organ you're looking at, because the ultrasound will put you right on the spot you want. You say you see a tumor in the spleen that's this big, you put the ultrasound probe in the abdomen, you can see on the screen where the tumor is, and you put a needle directly using the ultrasound into that area and taking a sample out of it, and you can diagnose what type of tumor it is or what type of situation is going on there. So these are very, very, very good pointers to why ultrasound is a real fantastic tool in our arsenal. So I hope that was really informative to you all. If you have any questions on dog ultrasounds, please give us a call at Calusa Veterinary Center. Our area code is 561-999-3000, and we're always here for you. Remember, we're a 24-hour facility, so we're here for you day and night, 365 days a year.